NASA scientists as well as other innovators are busy developing alternatives to the traditional ventilator being used worldwide to treat severe cases of COVID-19. The movement is in response to growing evidence that in some cases ventilators can cause more harm than good in some patients with low oxygen levels. Statistics tell the story: 80% of patients with the coronavirus die on such machines. This comes just a few months since the early days of the coronavirus pandemic, when U.S. healthcare providers said that they needed ventilators to accommodate the flood of new patients, and lots of them. The crisis triggered the Trump administration to activate the Defense Production Act so manufacturers including Ford, GM and GE could start ventilator production to produce these medical devices for the U.S. government. According to the healthcare news publication Stat, today's growing skepticism about ventilator use is driven by the fact that many of the coronavirus patients doctors treated had blood oxygen levels so low it should have killed them, but didn't. Since physicians have traditionally used blood oxygen levels to judge whether to put a patient on a ventilator, this usual phenomenon with COVID-19 patients throws established protocols into question. Furthermore, it calls into question whether less invasive breathing support could be an effective option. Sunny Jha, an anesthesiologist at the University of Southern California who also treats critically ill COVID-19 patients at the Los Angeles Surge Hospital, said that the way ventilators supply lungs with oxygen can actually cause damage to the lungs, in certain cases. This sort of stretching caused by air being pushed into the lung via the ventilator, versus being pulled into the lung in normal breathing, can cause damage, or barotrauma, to the lung cells, further worsening the lung damage from the virus, he said. This builds up over time and can lead to a more rapid worsening of the lungs, if they do not start to get better on their own. Turner Osler, M.D., Fax, M.Sc. Emeritus Professor in the Department of Surgery at University of Vermont, said that in cases such as those, caregivers are faced with a dilemma, which he described as a deal with the devil. The elevated ventilator settings required to support some COVID-19 patients can actually damage their lungs further, he said. It buys time, putting off imminent death, but at the price of further damaging the lung. He stressed that a ventilator is an emergency solution to a life-threatening problem, and in many cases is the go-to solution. However, he added that patients who are put on ventilators may have a long and difficult road ahead of them when it's time to get off of them. Getting a patient off a ventilator can require them to redevelop the strength needed to breathe, he said. This can be a prolonged effort known in the intensive care unit as weaning, a process that can take days, or even weeks.